Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. NCDC publishes 7th Public Health Advisory on COVID-19 following third phase of eased lockdown. It has advice for health workers, businesses and other guidelines. More challenges for Nigeria's health sector as Joint Health Workers Union, JHESU, threatened to embark on strike next week, while it's day 2 of the Nigeria Association of Resident Doctors strike with no consensus yet. And a worrying pattern seen across Europe as Netherlands' coronavirus infections increase sharply in recent days. In the last 24 hours, 218 persons recovered from the coronavirus in Nigeria in 12 states and the Federal Capital Territory. 95 people recovered in Plateau State, 38 in Edo, 25 in Rivers, 15 in Ogun with the FCT 12, 12 as well recovered in Ebonyi State, 5 in Ekiti, 4 in Kaduna, 4 in Akwa Ibom as well, 3 in Bayelsa, 2 each in Oyo and Osun State, and 1 person recovered from Imo State, but the country recorded 4 deaths. That's in Rivers, Ebonyi, Oyo and Sokoto states. New cases from the Nigeria Center for Disease Control announced 155, putting the total confirmed cases at 55,160. The cases were reported in 15 states plus the Federal Capital Territory. Total sample tests conducted in Nigeria so far stands at 426,803. Meanwhile, globally, the coronavirus has killed over 880,000 people worldwide. More than 18 million people have recovered, with global confirmed cases at over 27 million. Many believe that most countries are testing only symptomatic or the most serious cases. This week, countries with the most new deaths were India, Brazil, and the United States. Now, the leadership of the Joint Health Workers Union, JHESU, has given the federal government till September the 13th, which is about a week from now, to address all lingering labor issues with its members or risk a nationwide industrial action. Speaking at an expanded meeting of the union in Abuja, the president of JHESU insists that the federal government has been paying lip service to all conciliation agreements entered with the government. The health workers are asking federal government to pay the COVID-19 hazard allowances for their members and also pay all outstanding salary arrears.
The Federal Ministry of Health has been playing childish tricks with the implementation of COVID-19 inducement allowances, which was originally designed to replace the payment of 5,000 hazard allowance across board to all health workers, with a 50% basic salary of these personnel on April 21st, 2020. The federal government continues to implement a selective no work, no pay policy, which has dealt decisive blows on some of our members in FMC Owerri, Jute, and Lut. These lingering welfare challenges are: 1, review of implementation of COVID-19 special inducement and hazard allowance, payment of all withheld salaries of members at FMC Owerri, Jute, Lut, including April and May 2018 salaries. In the event that the 5 demands are not met by midnight of September 13th, 2020, JHESU will commence a nationwide 7 days warning strike of our members in all FHIs. The state and local government health institutions are placed on notice for further directives to join the fray.
That's from the leadership of the Joint Health Workers Union. In the meantime, resident doctors in Akwa Ibom State, they've joined the nationwide strike in line with the national directive from the National Association of Resident Doctors, NARD, to press for better work environment, welfare and improved healthcare delivery in the country. Channels Television visited the University of Uyo Teaching Hospital to assess the impact of the strike.
It's really very sad that we have to take this very inconvenient action once again. I want to say that it's not a new strike, it's just a resumption of the old strike, which we suspended in the interest of the suffering masses, based on promises that the government had already made to meet certain demands. But unfortunately, despite the extension in ultimatum that was given, more than double the time we had actually planned to give them, the government has really not shown any seriousness in addressing the fundamental issues, affecting the healthcare workers.
I would say that we have a very good relationship with our unions, including the Association of Resident Doctors, and we try to carry them along in all the decision making and all that. I would say that as early as Thursday last week, the resident doctors had informed me of the national developments, that there was going to be a strike. And on Friday, they presented me with a notice of strike with a national communique. Well, I tried to reason with them, trying to plead with them on how we could, mitigate or reduce the effects of the strike. But they told me that this is a national strike, a national issue, as much as they would want, to cooperate with the hospital management and keep the hospital running. But they would have to, they'll be sanctioned by the national body that they have to obey the strike. I tried to strike a compromise. Okay, well, please, even if you're going on strike, at least let us keep the emergency services open. Now, this morning, when I came to work, what I did was to go around. And I'm sure if you probably go around, I went to the general outpatient department. I saw a whole lot of patients there. Patients are still being attended to, howbeit by mainly the consultants. And even in the A&E, we still have patients there. And the consultants are trying to run around to see, what they can do. The truth is that if the strike goes on for quite a number of days, or a long time, the effects will be a lot.
In Sokoto State, resident doctors say that they have complied fully with the strike action embarked upon by the national body on Monday, September the 7th. This was made known to journalists by the state chapter chairman, Dr. Safiyanu Umar Yabo. According to him, it follows the federal government's inability to fulfill most of the association's demands. While in Abia State, NARD chapter also commenced an industrial action in compliance with the nationwide strike. Dr. Emeka Onu, chairman of ARD Federal Medical Center Umuahia, in a telephone conversation said that all resident doctors have been directed to stay at home. Now, the Nigeria Center for Disease Control, NCDC, through the National Emergency Operations Center, has continued to lead the national public health response in Nigeria with oversight of the Presidential Task Force on COVID-19. The NCDC is also working closely with all states of the Federation to support their response activities to the pandemic. The center has published a new public health advisory on COVID-19 with updates on the third phase of ease lockdown, travel advisory, advice for health workers, businesses, and other guidelines. Joining us from our Abuja studios is Madam Chioma Danwafo. She's a senior epidemiologist with the Nigeria Center for Disease Control. Thank you so much for joining us on the program.
Good evening, Nigerians. Thank you, Melissa, for having me.
All right. We understand that the public health advisory on COVID-19 is a revised one. This is the 7th. What has changed since the last one?
Yes. So the public health advisory was changed following the third phase of the ease of lockdown. If you recall, the PTF has been we're going through phases of the easing of the lockdown since May, and with the recent one, we have highlighted key measures to address the current issues based on the realities and the context of our country, Nigeria. This is basically to address and balance issues around economic, socio-political, and also the health concerns of COVID-19. So the first on the list is the current nationwide curfew. If you recall, for the second phase, we had the curfew between 10 a.m. and 4 p.m., but now it's between 12 a.m. and 4 a.m. And also for mass gathering, we've increased from the initial 20 persons that was allowed for mass gathering to 40, but then ensuring that the non-pharmaceutical interventions are strictly adhered to while people gather for burials or for other activities. Then opening of airspace. Before now, the international airspace was closed, but now FCT, the international airport, Lagos and FCT have been opened up, and we now have a portal called the NIPTS, that's the Nigerian International Portal, Travelers Portal. So this is to ensure that all travelers that are coming in or leaving the country gets tested. So you link up to this portal, which is the website, which is nipts.ncdc.gov.ng, and put in your details. It will direct you to an access where you can pay, and then also schedule for when your test will be conducted. That will be on the 7th day on arrival in country, or 96 hours before you depart Nigeria. That's for outbound passengers. So this is in collaboration with the private sector. Most of the testing laboratories are the private laboratories. And also we have, for the mandatory use of face masks, that is still in place. Nothing has changed. For face masks, we're also encouraging service providers to ensure that the no mask, no policy is strictly adhered to, and that people comply before they come into public places. Also, elections, as Edo and Ondo plan to go to the polls, we are also emphasizing that voters must wear their masks, and also at the physical distancing. So the no masks, the no voting is one of the key highlights of the current guideline that we have released.
But another question as well is, how much are people listening to this, the population that we have? You've put this out there, but are you breaking this down so that people are aware, people can wear their face masks, and those coming in, how much of surveillance will be taking place at the port of entries since domestic and international flights are now on?
Yeah. Thank you. So it's quite unfortunate that the risk perception for COVID is on the decline. So we're noticing that people are throwing caution to the wind. They're no longer wearing the face masks. But then we continue to pass these messages through the traditional and social media platform, and in collaboration with the state, because for this outbreak, it's the states that are leading the response to ensure that people adhere to the non-pharmaceutical intervention, that is wearing of the face masks, mandatory wearing of face masks in public places, personal hygiene, ensuring they wash their hands, and also cough etiquette, coughing into their elbow or using a handkerchief, and also physical distancing. So we cannot overemphasize on this non-pharmaceutical intervention, because it has worked. For countries that have been able to contain the virus, this has been shown by research and evidence and science that it works. So as a country, we all need to take responsibility and ensure that we adhere strictly to the non-pharmaceutical interventions. And for the for the testing, And for passengers that are coming in, we have also put measures in place. It's a multi-sectorial response led by, through the PTF. There have been some guidance that have been put in place. We are working with FAN, NCCA to ensure that all passengers that are coming in adhere strictly to all the measures that have been put in place.
All right.
On the website, it is clearly spelled out that the test must be conducted on the 7th day. And once you come into the country, first and foremost, you must have carried out a test from the country that you're coming from, and you have a negative test that you upload on the website. And once you come into the country, you would self-quarantine for a period of 7 days. And after the 7 days, you you conduct the test, and if it's negative, then you are free to reunite with, conduct your daily activities or unite with with the public and carry out your normal activities.
We'd like to thank you. We appreciate your coming on the program. Chioma Danwafo, Senior Epidemiologist with the NCDC. Thank you so much, and all the best in your activities.
Thank you for having me.
The Cross River State Government has inspected and donated equipment at the Medium Security Correctional Centre in Calabar to help contain the spread of COVID-19. Speaking at the Medium Security Custodian Centre, the Commissioner for Health, Dr. Betta Edu, said the centre has not taken in any inmates since March this year to ensure the safety of the inmates already in custody. According to her, it also intends to create a link between the COVID-19 pandemic response team and the Custodian Centre to certain the status of inmates before they are taken into the centre.
Since March this year, the correctional services has not been able to take in inmates into the centre, inmates from the police, from the court, DSS, drug enforcement, name it. They've been unable to accept them in here, and the reasons are simple. We had COVID-19, and they were doing everything within their bit to see that they can isolate those who are already in the center and prevent COVID-19 from coming into this facility. But however, there is pressure on criminal justice system right now. And so they need to begin to take inmates into the correctional center immediately. Our visit today was to inspect the isolation centers and to donate items that will fully equip the isolation centers. We also want to create a link between the rapid response team in the COVID-19 task force to link them up with the correctional center so that whenever there are people that are supposed to be taken in, they would come in, take their samples, and within 24 hours, this result should be made available to the correctional center to decide if the people are supposed to continue in the isolation wards or if they should be moved into the general cell. If they are found to be positive, they would be kept till they become asymptomatic, and after 14 days, they would also have this test done again.
The Director General of the WHO declared the COVID-19 outbreak a public health emergency of international concern on the 30th of January 2020, and later in March he characterized it as a pandemic. What is the current situation of the outbreak in Nigeria, and how can we effectively engage community health workers for an appropriate response? We have Mr. Solomon Cholom, a medical virologist. He joins us via Skype from Jos. Thank you so much for joining us on the program. I want to begin by asking, what is staring us in the face is Joheso's threatened strike. We have the Association of Resident Doctors who are on strike at the moment. But do you think that with all of this staring us in the face, that we have integrated, or rather started integrating COVID-19 protocol services into our healthcare system, especially, given that we have established community transmission that's ongoing?
Well, it is very unfortunate that these strike actions are happening at a time like this. And the government must just necessarily sit up to, look into these, issues. Clearly, this speaks of the healthcare policies, the healthcare, basically the attention our government gives to healthcare services, especially with regards to the welfare of, healthcare personnel. So I want to call on the government to quickly look into these grievances and, get the workforce back on track. Now, looking at it, Clegg, basically, we need to actually integrate a whole lot into our, healthcare services as the new normal. Basically, what calls for attention is issues that have to do with, basically infection prevention and control strategies. We don't have to leave our hospitals open for people to just come in and go out. There has to be, basically to erect infection prevention barriers right from the entrances of our hospitals to ensure that people, come in using face masks, to ensure that movement is restricted. Basically in Jos here, there are some engineers that have come up with, a decontaminating machine, which, that in itself is going to go a whole lot to institute this. The machine, if positioned, at the entrances of places, is able to first and foremost take the temperatures of people digitally. It's able to also screen those people wearing face masks and those not wearing face masks. And within it, there is this decontamination going on there. Whereas you must also have a hand sanitizer within to sanitize your hand before it allows you to enter. So if this, machine is installed in, the premises of hospitals to allow for passage and, exit, is going to go a long way to screen, as much as possible digitally, people going in and coming.
So essentially instituting infection prevention barriers. We'd like to thank you, Solomon Shalom, medical virologist. Thank you for joining us at this time.
Thank you.
Now we turn to the Netherlands, where coronavirus infections have increased sharply in recent days, mirroring a worrying pattern seen across Europe. A further 5,427 infections were confirmed in the week up to Tuesday, up from 3,597 the previous week. Here's more on the global update.
Chinese President Xi Jinping has presented awards to those he says are role models in the country's fight against the COVID-19 pandemic, saying the country's national strength enabled it tide over the difficulties brought by the virus. He also commended the abundant material bases accumulated, the complete industrial system, the strong sci-tech capacity, and rich reserve of medical resources stored over a long period of time to provide a robust support for its epidemic prevention and control.
We never had really strong guidance either from the state.
Medical experts say the coronavirus situation in the United States is at its worst due to a lack of proper guidance from authorities. The country remains the worst hit nation by the pandemic, with 26,071 new confirmed cases recorded on Monday and more than 6.2 million cases and over 189,000 deaths. The number of infections in over 20 states keeps increasing as well, especially those with much lower population densities in the central and western part. Spain says the number of cases needing hospitalization has increased slightly, with 7,892 beds currently occupied by COVID-19 patients of those with a high probability of having the disease. The health ministry says hospitals are not in the situation they were at the start of the pandemic, where they were on the verge of collapsing. In France, the health minister says the COVID-19 situation in the country is worrying, with daily new cases at record levels, but a second wave of infections is avoidable. France in recent weeks has been registering a radical increase in the number of COVID-19 cases compared to May Day, when its strict 2-month lockdown ended.
Channelstv.com is our website. You can find the latest updates on the pandemic. All you need to do is log on and you can access the stories. There's several other stories there as well. It's an upbeat mood in Beijing. As you can see, China is celebrating its COVID-19 successes. You can find that story in detail. It's channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Nwonka. Stay safe.